PRP treatment or newer mesotherapy treatments like GFC treatment, QR678 treatment or exosome treatments are only types of adjuvant treatment to the medicines in any type of hair loss, whether it's male or female pattern hair loss or normal hair loss. Now do understand that these newer treatments like GFC treatment, QR678 treatment or exosome treatment are no way better than your old gold standard PRP treatment in any aspect. And these newer treatments are not going to do any wonder on your scalp and hair what your old gold PRP treatment cannot do. But why these newer treatments like GFC, QR678 or exosomes have become so famous in the market? It is only and only because it is a very difficult task for a dermatologist to make platelet-rich plasma, which is always freshly prepared, in which your dermatologist needs to withdraw minimum 60 ml of your blood. Your dermatologist needs to put that 60 ml of blood in centrifuge machine 2 times within 45 minutes. After the first spin, your doctor will first throw RBC settle at the bottom out. Then after the second spin, your doctor will throw the WBC along with yellow plasma out. And then a white small band of platelets which will get settled at the bottom attached to a very tiny quantity of RBC will have to be suspended or mixed in a very tiny 9 ml of plasma. And then this plasma will be known as platelet rich plasma because the number of platelets present in this 9 ml of plasma will be almost 10 times more than the number of platelets present normally in your blood. And that's why this 9 ml of platelet rich plasma will be very rich in growth factors. But since this task is very cumbersome, it is very difficult to make a nurse or technician learn. It takes almost 1 hour of doctor's time. That's why most of the centers have replaced it with normal plasma injection treatment, in which centers have started taking only 10 to 20 ml of your blood. They started rotating it in centrifuge machine for 10 minutes and extracting the yellow plasma out and giving that yellow plasma into the scalp. Now, since this plasma treatment was not PRP treatment, that's why it has stopped giving any result in hair loss. Then these newer treatments like GFC treatment, QR678 treatment or exosome treatments have got much more publicized in the market. In followed GFC, which is very famous, there are 4 GFC vials in which a jelly is present which is enriched with frozen growth factor concentrate, in which we take your blood around 20 ml and then we rotate it in centrifuge machine only for 10 minutes, and then that jelly sends the growth factors into the plasma and then we inject that plasma into your scalp. Same goes for QR678 treatment. It's a cocktail of peptides and amino acids and growth factor which when we inject into the scalp promotes hair growth and reduces hair fall. And the same goes for exosome treatment. Exosomes are very tiny vesicles enriched in growth factors and peptides, and which when injected into the scalp stimulates hair follicles and promotes hair growth. But these newer treatments are so quick, so easier to learn for any nurse and technician that most of the centers have started promoting this. But always remember that your old gold standard PRP will always remain more effective and more precise than these newer treatments if done with proper SOP.